The information in this video will provide you with a better understanding of total joint replacement surgery. Your options and their benefits to you will be explained, as will the important guidelines for postoperative care and compliance. The long-term goal of total joint replacement surgery is to provide pain relief, restore normal activities of daily living, and enhance your overall quality of life. Hip and knee joints worn out or damaged by arthritis is an age-old problem. There was no long-term solution for this problem until the early 1960s, when the first successful total hip replacement surgery was performed in England. By the mid-60s, total joint replacement had been imported to this country, and since that time has gradually been improved to the point where it is now quite successful. The results of this surgery have been spectacular and the complications few, as the benefits are regularly extended to both the young and the young at heart. Unfortunately, there are common misconceptions about what total joint replacement is. Although it sounds like it may involve the amputation of a portion of your body, it is simply the resurfacing of the relatively small portion of your bones affected by arthritis. For most patients, this restoration of joint function returns them to an active lifestyle they haven't experienced in years. If you still have unanswered questions after viewing this video, please sit down with your physician, who will be happy to go into further detail regarding total joint replacement surgery. Also, you can further research the procedure and the implant technology your surgeon uses at www.smith-nephew.com. The three bones comprising the knee joint are the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. The knee can be described as a modified hinge joint, similar to the hinge on a door. The knee also has a complex rotational component that occurs with flexion and extension of the knee. The knee is a major weight-bearing joint that is held together by muscles, ligaments, and other important soft tissues. Cartilage is the material inside the joint that provides shock absorption to the knee during weight-bearing activities such as walking and stair climbing. Arthritis afflicts 1 in 6 Americans and is the leading cause of disability. The most common form of arthritis is osteoarthritis. It is usually referred to as wear and tear or degenerative arthritis, and occurs most commonly in patients over age 50, but can occur at any age, especially if the joint has been previously damaged by injury. It is normally confined to the large weight-bearing joints such as the hips and knees, but may affect the spine and upper extremity joints as well. The most common symptom is pain in the hip or knee during weight-bearing activities, and in many people the pain is so severe that sleep is regularly interrupted. People with hip or knee pain usually compensate by limping or simply reducing force on the arthritic joint, thus weakening surrounding muscles and making joint stability a further complication. As a result of cartilage degeneration due to osteoarthritis, joints lose both flexibility and strength, and often bone spurs develop on the joint's bearing surfaces. If the condition is allowed to worsen, you may experience pain at all times, even during non-weight-bearing activities. This has obvious negative effects on your lifestyle, perhaps needlessly so. Total joint replacement is now a very viable and successful option for alleviating the pain that accompanies degenerative hips and knees, but it is not the only option. Before considering total joint replacement, you may want to discuss these non-surgical therapies with your doctor. An appropriate weight reduction program may be beneficial for decreasing force across the joints. However, this can be difficult for people with arthritis since the pain precludes them from increasing their activity and burning calories. Your doctor can prescribe specifically designed exercises to improve strength and flexibility without increasing your pain. Various medications such as non-steroidal anti-inflammatory drugs and nutritional supplements may be used to decrease swelling in the joint and provide temporary pain relief. Powerful anti-inflammatory agents and injections designed to improve lubrication can be injected directly into the knee joint. Bracing may be used to provide external stability to joints. Assistive devices such as canes and crutches may reduce the force transmitted to the joints during weight-bearing activities and thereby may help decrease your pain. These are just a few of the options to consider before committing to total joint replacement surgery. Although many of these solutions may help to temporarily alleviate the pain, they may not give you long-term relief and the opportunity to return to daily activities. If non-surgical treatment is unsuccessful, you and your surgeon may want to begin the discussion about total joint replacement. In the knee replacement procedure, each prosthesis is made up of 4 parts. The tibial component has 2 elements and replaces the top of the shin bone or tibia. This prosthesis is made up of a metal tray attached directly to the bone and a high-density plastic spacer that provides the bearing surface. The femoral component replaces the bottom of the thigh bone or femur. This component also replaces the groove where the patella or kneecap rides. The patellar component replaces the surface of the kneecap, which rubs against the femur. The patella protects the joint, and the resurfaced patellar button will slide smoothly on the front of the joint. In some cases, surgeons do not resurface the patella. Each of these components is the result of years of engineering, research, and testing, not only of the mechanical designs, but also of the materials used to make them. Intense work over the last several decades at such companies as Smith & Nephew has produced implants that may last longer and have more successful outcomes than were previously achievable. Scientists work diligently to measure and reduce the friction and wear between the implant surfaces while still retaining the strength and versatility necessary to return the patient to an active lifestyle. Strict manufacturing processes also ensure consistent implant quality by adhering to design specifications practically down to the microscopic level. One of the keys to a successful implant is its ability to withstand the rigors of daily activity, and central to that is the quality of the artificial surfaces that slide against each other or articulate in the new joint. In knee implants, bearing surface options have been somewhat limited over the last few decades. The standard substance used for the femoral component is cobalt chrome, a metal alloy typified by its toughness and biocompatibility. However, even this high-quality industry standard has its shortcomings. Over time, this metal surface can become roughened by bone and bone cement particles trapped between the femoral component and the plastic tibial insert. As you might imagine, this roughened surface, when rubbing against the plastic component up to 2 million times per year, can more quickly wear out your implant. When that happens, you will have to undergo surgery to replace the plastic piece, the femoral component, and possibly even the tibial component. In more extreme cases, a patient may develop osteolysis, which is the softening and degradation of bone caused by the body's reaction to the worn plastic particles released around the joint. For this reason, implants have been shown to last between 10 and 15 years in the human body. To combat this plastic wear, in an attempt to extend implant life, device manufacturers have tried substances other than cobalt chrome articulating on plastic. For instance, in past years, some surgeons briefly tried a ceramic femoral component. Ceramic components have extremely hard abrasion-resistant surfaces. In fact, a ceramic surface can be up to nearly 5,000 times more resistant to abrasion than cobalt chrome, which can dramatically reduce the joint's wear, thus potentially extending its lifespan. However, as you might imagine, the physical stresses on the knee are quite rigorous, and ceramic proved to be unworthy of the task. The components were too brittle and fractured at high rates even under normal conditions, and they are not currently available in the United States. The most exciting material to enter orthopedics in recent years is oxinium oxidized zirconium. This remarkable new material combines the strengths of ceramic and metal, such as wear reduction and strength, but does not have the weaknesses such as limited implant options and the possibility of fracture. Zirconium is a biocompatible metal, similar to titanium. When the zirconium alloy undergoes a unique heating process, the surface of the metal transforms into a ceramic. Even though the new ceramicized surface is as abrasion resistant as actual ceramic implants, it retains the toughness and flexibility of the underlying metal. Because it can achieve this remarkable reduction in implant wear without sacrificing strength as actual ceramic components do, oxidized zirconium implants have the potential to last significantly longer, thus possibly reducing the need for future corrective surgeries. When articulating on standard plastic tibial components, oxinium knee implants reduce wear by 85% compared to cobalt chrome. Before you are taken to the operating room, your anesthesiologist will talk with you about the medications used during the procedure, and he will administer the medications once you are in the operating room. A primary total knee replacement procedure typically takes between 1 to 2 hours to complete. The doctor begins by making an incision extending from the thigh past the inside edge of the kneecap and down to the shin bone. After making the initial incision, the doctor will shape the end of the femur in preparation for sizing the femoral component. In the same way, the top of the tibia is shaped for proper sizing of the tibial component. Next, the provisional or trial units are put in place and the appropriate implant size is confirmed. After the appropriate implant size is selected, the knee is assessed for alignment, stability, and range of motion, and the underside of the kneecap is prepared and the patella trial is selected. Then, the trial units are removed and the final femoral, tibial, and patella components are implanted. The doctor will finish the procedure by closing the incision, implanting a tube to allow drainage, and applying the post-operative bandages. You will be taken to the recovery room. In the recovery room, the staff will monitor your vital signs until you are transferred to your hospital room. Total joint replacements are very complex procedures. However, the outcomes following surgery are most often very successful. One of the critical success factors for positive outcomes is following the physical rehabilitation process. In order to achieve the goals for a successful total joint replacement, you must actively participate in the rehab process and work diligently on your own. You must cooperate and work with your physical therapist to achieve optimal results. Depending on the procedure performed, rehab techniques and times will vary. Many times, rehabilitation with the therapist begin as soon as 1 to 2 days following total joint replacement surgery. The goals of the rehabilitation process are simple. Return the patient to normal activities as soon as possible, and teach the patient proper ways to perform weight-bearing tasks. The rehabilitation process following total knee replacement surgery can be quite painful at times. However, if you commit to following your program and overcome the challenges in rehab, you will succeed in meeting the goals you set when deciding on surgery. The following outline will summarize the process you will adhere to during rehabilitation. In the hospital, continuous passive motion beginning day 1 or 2. Ambulation with a walker or crutches. Range of motion exercises. Edema control, ice, compression, elevation. Instruction in home exercise program. Discharge goals are as follows: independent getting in and out of bed, independent in walking with walker or crutches, independent in walking up and down 3 steps, independent in your home exercise program, ability to bend your knee 90 degrees, ability to fully straighten your knee. At home, begin ambulation with cane as tolerated. Continue CPM if necessary and range of motion exercises. Keep incision clean and dry. Watch closely for signs of infection. Continue home exercise program. outpatient physical therapy, advanced strengthening program, adding weights as tolerated, stationary cycling, walking program, aquatic therapy program. Long-term rehabilitation goals, range of motion from 100 to 120 degrees of knee flexion, mild or no pain with walking or other functional activities, independent with all activities of daily living. As you consider total joint replacement surgery, remember that more than 250,000 people undergo it in the United States each year. It has become one of the most successful surgeries performed, as it can return patients to a level of activity they may not have experienced in years. If you have additional questions about this procedure, talk with your orthopedist. If you would like further information about the joint replacement implant technology your surgeon uses, visit www.smith-nephew.com.